Hello everyone, my name is Dr. Akinshiko, and I welcome you to join me on a journey as we take a closer look at some of the exciting partnerships and bold moves that are reshaping healthcare in Nigeria. I'm talking about real on-the-ground projects where the public and private sectors are teaming up to tackle some of those biggest health challenges. Now, these partnerships are bringing fresh ideas, state-of-the-art technology, and most importantly, hope to a system that has been long crying out for change. In recent years, we've seen private sector players step up in powerful ways to launch hospitals, specialty clinics, that rival what you find abroad. Well, meanwhile, collaborations with government are slowly creating a more enabling environment, one that could actually keep more of our doctors at home and reduce the billions we lose to medical tourism every year. So, buckle up as we spotlight a few of these standout initiatives, starting with one that is very hard to miss, and that's the African Medical Center of Excellence in Abuja. Now, the AMCE is a 300 million project. I mean, it's really huge, and it's built right here in the heart of Nigeria's capital. It's backed by Afrexim Bank and run in partnership with King's College Hospital in London. So we are talking serious international standards here, and the goal is to create a hospital that specializes in cancer care, heart and blood disorders, and surgery. But beyond just treating patients, AMCE also aims to become a hub for training doctors and doing medical research. And once it's up and running, AMCE is expected to serve over 200,000 patients a year. I mean, that's huge. And the AMCE is designed to provide specialized services in oncology, cardiology, hematology, and general surgery. And that's a big deal. It means fewer people will need to fly out of the country just to get a diagnosis or receive life-saving care. So why does it matter for Nigeria? Let's be honest. Quality health care shouldn't be a luxury, but it is right now. And people in rural areas often have no access to specialists or advanced treatment. Even in big cities, getting a diagnosis can take ages, and for many hospitals, underfunding and they are overstretched, but AMCE could actually change all that. Designed to provide the kind of care that people currently travel thousands of miles to get, from high-tech equipment to highly trained staff. And the plan is to offer treatment that is on par with what you will find in top hospitals abroad. So that means more lives saved, fewer families drained emotionally, financially, by the need to seek care elsewhere. So it means we're keeping money at home, stopping medical tourism, because every year Nigerians spend over $1.2 billion on medical tourism. That's money leaving our economy, money that could be used to improve hospitals here. And with AMCE, the idea is to keep that spending local. So if people can get the care they need in Abuja, there's less reason to fly overseas. And in fact, with the level of service AMCE plans to offer, Nigeria could even start attracting patients from other African countries. That's flipping the script entirely, So another big issue is that so many of our best doctors and nurses are leaving Nigeria to work abroad. That's no news. Can't blame them. We can't blame them. The pay is better, the facilities are modern, and there are more chances to grow professionally. AMCE wants to change that too. By partnering with King's College Hospital, it will offer local medical professionals access to ongoing training, modern equipment, and research opportunities. These are things that are usually just available overseas, and that could keep our talent at home and maybe even encourage some of those who have left to come back. Who knows? So in the end, AMCE isn't just another hospital that is being built. It's about changing the game totally. It's about giving Nigerians access to the care they deserve without having to leave the country. How good does that sound? It's about making sure that our doctors and nurses have the tools and environment they need to thrive. And it's about keeping our healthcare money within our borders and investing in our future. So if AMCE succeed, which we hope it succeed, which we pray succeeds, and all signs suggest it will, then it could be the beginning of something very big, a new era for healthcare in Nigeria where quality and access are no longer out of reach. And the good news is that on the 5th of June, 2025, the AMCE was officially commissioned. in Abuja. The vice president was there, stood in for the president at the opening ceremony, and emphasized that the project was much more than bricks and more that it was about reclaiming our health system. Okay, that's good to know. It's not just a small clinic. We're talking about $350 million investment here, backed by Afrexim Bank and run in collaboration with King's College Hospital in London, one of the most respected medical institutions in the UK. Now, he already has 170 beds in phase 1 with plans to expand to 500 beds later, and it's packed with world-class equipment, I can tell you. MRI machines, CT scans, cancer treatment center, a huge stem cell lab, and even a cyclotron. So it's more than medicine, it's economic growth too. And AMCE is also not about health, it's about jobs and innovation, because over 3,000 jobs are expected to be created, and that's just the start. There's also a new Africa Life Sciences Foundation and like $75 million fund set up in partnership with Bank of Industry to help local companies manufacture medical equipment, develop new drugs, support the hospital's work, and it means Nigeria made solutions by Nigerians for Nigerians. And what it means for you and I is that at the end of the day, AMCE is about hope. It means that parents may no longer need to empty their savings to fight a sick child abroad, for example. It means that a young professional facing a cancer diagnosis can be treated close to family. It means that a Nigerian doctor can finally do world-class work without needing to emigrate. And most importantly, it's a sign that Nigeria is starting to invest in itself, which is very critical, very important. In its people, in its potential, in its health. That's very important. And we've waited for a long time for a moment like this. So AMCE it might not fix all our healthcare issues overnight, but it's a powerful start, good start. And for the first time in a long time, the future of healthcare in Nigeria looks like something we don't have to dream about abroad. It's happening right here at home. Thank you. See you on the next one.